Good afternoon, and thank you for joining us for Blessing's virtual Lunch and Learn. In honor of Heart Month, today we're talking about your heart health and how to recognize and survive a heart attack. As we talk today, you can post your questions in the chat box and we'll answer them throughout the discussion. I'm Laura Wheatholder. I'm a registered nurse and community outreach coordinator for Blessing Health System. I'm joined by cardiologist Dr. Jeffrey Cook with the Blessing Heart and Vascular Center. Dr. Cook, thanks for joining us. Can you take a minute to introduce yourself and tell us a little bit about your practice?
Sure. So as you said, I'm Dr. Jeffrey Cook. I'm an interventional cardiologist at Blessing, specialized in disorders of the heart and blood vessels, and also some valvular issues as well. As an interventional cardiologist, we're kind of the front lines for patients that come into the ER or the hospital overall with a heart attack. So kind of specialize in procedures to address that and typically open the artery.
All right. Well, thank you so much for joining us today. And as I mentioned, we are focusing on heart attacks. So let's start with some basic background information. What is a heart attack?
So a heart attack in the medical world, we call it myocardial infarction. Basically, the easiest way to think about it, it's an abrupt cutoff of blood flow to the vessel. Similar to when you think of a stroke and a heart attack, people frequently get those two mixed up, but they're similar in that a heart attack is abrupt cutoff of blood flow to the heart, whereas a stroke is abrupt cutoff of blood flow to the brain. Once the blood flow stops, the tissue in the heart becomes acidotic, and people will start to experience that typically as chest pain.
Great. So the heart is a muscle, so it needs blood as well. So that's why heart attacks are such an emergency. They have to have blood flow to keep pumping to circulate blood to the whole body, correct?
Absolutely. So, when you start losing blood flow to the heart, actually the heart kind of pumps flow to itself first. Those are the first arteries that come off from the first artery off the heart. When you start losing blood flow to the heart, the muscle, a clock kind of starts. We say in the cardiology world, we say time is muscle, meaning that the more time that goes on from the time that artery closes, the more damage that happens to that muscle tissue. And so, like you said, it is an emergency to get that sorted out so that we can, in most cases, reopen the flow to the heart and prevent the damage that's occurring.
So you briefly mentioned chest pain as one of the symptoms, but it can be difficult to recognize because sometimes the symptoms aren't always as obvious or they're not what we expect them to be. What symptoms of a heart attack should people be watching for?
So chest pain is still the most common. It's usually moderate to severe pain, typically in the center of the chest, kind of, I don't know if you can see me, but right about here. Sometimes people will actually make a fist like that and put it over their sternum. That's called Levine's sign, but that does have an association with the pain, being from the heart. Like the cinematic kind of heart attack would be the elephant on the chest, and some people do feel that, and so definitely if you're feeling an elephant on your chest, don't ignore that. Short of that specific feeling, I think heartburn maybe, or severe heartburn would be the next most common thing that I hear in terms of the way they experience it. Oftentimes shortness of breath or severe shortness of breath is associated with the heart attack. Some people don't have chest pain at all, unfortunately, and that can make it confusing. I think severe shortness of breath would probably be the next most common thing that we hear, without the chest pain that people are experiencing, and they maybe didn't think it was a heart attack because they weren't having chest pain. Other things to look for: if it's radiating somewhere, especially your jaw, down your arms or to your shoulders, that's a big giveaway that it's from the heart. Severe sweating often happens. In some kinds of heart attacks, people get very nauseous and are vomiting. So that can be also a giveaway for it being a cardiac cause for the pain. Sometimes people don't feel any of those things, and so those are the hardest to sort out. But I've had people over the years just say that they felt so weak they couldn't get up out of bed, and they ended up, at that time having a severe heart attack, falling to the floor, not being able to get up because they feel so weak. So that would be less common, but that could also be, something that people experience.
So I think with either subtle or obvious signs, the main point would be if you feel like something isn't right, it's best to err on the side of caution and seek emergency assistance.
Exactly. So, the pitfall that people fall into is trying to either maybe ignore it and hope it goes away, or try to figure or attribute the symptoms to something else. So that would probably be the number one thing that I would recommend that you don't do. As my partner, Dr. Kraus, says, let us figure it out. People feel reluctant to come into the emergency room because they think it might not be a heart attack, but that's okay. If it's not, we'll sort that out. But it's very important, when the symptoms start. If there's any question, you should get it looked at urgently, because if it is a heart attack, even if your symptoms aren't like that elephant on your chest, we can kind of get the treatment started and prevent more damage that can be occurring.
And sticking with symptoms, I understand for women, some of the symptoms might be a little different or unique to women. Can you talk about how maybe what women specifically need to watch for?
Women, I would say, again, can still feel that classic kind of chest pain or that pressure or elephant on the chest. Probably women are a little bit more common in my experience, but I think that it also bears out in studies that look at this. Will tend to have less severe symptoms, might just have kind of like a vague discomfort in the chest, or might experience it more as that severe shortness of breath. Women, diabetics, and patients that are, I would say, over the age of 70 will have less of the typical symptoms, and it makes it a challenge, unfortunately. And I think it underscores, as you were saying, just don't try to figure it out. If anything that's out of the ordinary, that's kind of a sudden onset, and you're feeling very poorly, just get it checked out. But definitely better safe than sorry.
Great. So we touched on this a little bit briefly earlier as well, but we do see patients occasionally who are hesitant to call 911 because they don't want it to be a false alarm, or maybe they think that they can get to the hospital faster if they drive themselves or have somebody drive them. Why is it so important that they don't do that, that they call 911 if you think you're having a heart attack?
So I think there's a lot of reasons for the importance of an ambulance. As we talked about before, once the artery is closing or starting to close, the clock has started, and for the urgency of getting that artery open. But I think even more importantly, that can become very unstable, especially when we talk about kind of the worst kind of heart attack to have, which is a STEMI. Typically, the artery is completely closed and the heart is majorly being starved of blood flow and oxygen. It could become very unstable very fast, especially arrhythmias. So, that in fact, in terms of what causes people to die during their heart attack, it's usually the rhythm, either becoming ventricular fibrillation or the heart stopping. If you call 911 and you get the paramedics, EMTs there at your house right away, they can treat that in the ambulance. So they'll hook you up to a EKG and defibrillator right away. If your heart does stop, they can bring it back. Usually, it will come right back if they can promptly give you the shock. The other thing that I think people don't think about is that if you are driving yourself and that happens, you're going to lose control of your vehicle, and you put yourself and other people in jeopardy. So those are the main reasons. Kind of they can get there fast. They can start treating you while they're bringing you to the hospital, and then you just avoid all the secondary risks that you're putting yourself under. I mean, short of that, I know. I guess I think the key, as you said, call 911. That's the way to go. Short of that, don't drive yourself.
So beyond safety and, of course, getting the treatment from our well-trained paramedics and EMTs, many people might not realize that if they call 911, the ambulance is going to notify the hospital. So your staff is actually prepared, and it can, in many cases, be there waiting for that patient when they arrive. Is that correct?
Correct. So, we have in the cardiology world, we talk about door to balloon time, meaning what is the best way we can save a person and save the heart? That's getting them into the hospital, into the cath lab, and then getting their artery open as basically as fast as we can. The quicker that we're able to do that, the better chance, in general, that a patient will have for survival. So, as you mentioned, they will in the ambulance they'll do an EKG, and if the EKG shows that they're having that kind of heart attack that we need to act quickly, they're usually able to fax that to the emergency room, and they can actually activate the cath lab. So whatever cardiologist and their team that are on call can come into the hospital and even sometimes meet the patient directly in the emergency room, and even skip the emergency room sometimes and go straight to the cath lab. So, so you're right. So that's another reason. It's just they can get the ball rolling a lot faster.
Get treatment faster if you arrive by ambulance. So kind of you touched on this earlier as well, but there are two components to surviving a heart attack: early recognition, knowing the signs and symptoms, and then early treatment of a heart attack. In some cases, heart attacks can lead to cardiac arrest, which is what you talked about earlier. What is cardiac arrest, and what should you do if you're with someone when that happens?
So cardiac arrest is kind of what it sounds like. It means the heart has stopped beating for some reason. It can either be because the electrical activity is kind of just going haywire, which is like ventricular tachycardia or ventricular fibrillation. Other rhythms that can do it would be kind of just sinus arrest, or the heart just kind of just stops beating. It's not exactly the same as a heart attack. It can be associated with a heart attack. Certainly there are other causes for cardiac arrest, but in any case, if you're with somebody that seems to be in duress and then has a cardiac arrest, what's recommended more so now by the ACC/AHA is to kind of the two-step process. First of all, call 911, or have somebody around you call 911, and then commence basically with just chest compressions. So CPR in the past for the layperson would include mouth-to-mouth resuscitation as well as chest compression, and we're de-emphasizing the mouth-to-mouth side of things. We want people to get good chest compressions to basically keep the blood circulating in that early time. It's much more important to keep the blood flowing than it is to oxygenate, especially early on. And then since you have call 911, when the responders get there, they can get the airway side of things taken care of.
And I would be remiss if I didn't mention that if anybody is interested in learning about those two steps, there really is only two steps. You call 911 and you start compressions. If you want to learn more about that, you can go to our website, blessinghealth.org, and there is a full instructional video on how to perform HandsOnly CPR. So if you need more information, you can check that out.
The other thing I would say about that too is if you've got the 911 operator on the phone, they'll be able to help you. They'll direct you on what to do, and you put it on speakerphone, and they'll tell you exactly what to do. The only time that you might not want to do that, I think a child, we don't know that the hands-only CPR is the way to go for children. It definitely is the way to go for adults. And then rare things like drowning or somebody that's maybe been at smoke, inhaling smoke or something like that, then the airway side of things becomes more important.
Great point. Thank you. So we have some questions about risk factors and maybe what could help you. We got a question from one of our viewers. Does chillable red wine, or I guess just red wine, pose a significant risk or benefit to heart health?
So red wine, it's a good question. I think the take-home message as far as red wine goes, or alcohol in general, is in moderation. It doesn't necessarily pose really any risk to the heart. You can find studies that support using red wine, and we don't know if that's because of something specific to the red wine, or is it more so the antioxidant property of the juice component of the wine. But there seems to be a slight protective benefit in terms of anti-inflammatory effects and that sort of thing. It's definitely safe, in moderation. wouldn't take that to mean that you should have a bottle of wine every day, or something like that. As far as alcohol in general goes, we know that in moderation it's safe and probably maybe slightly beneficial, just not in excess.
Okay. Here's another question from one of our viewers. If I'm having heart attack symptoms, should I take a baby aspirin after I call 911?
Absolutely. So, and it doesn't even have to be a baby. Any aspirin, a full adult aspirin would be fine. And they actually recommend chewing it, which isn't going to taste very good, but you start to absorb the aspirin through the mouth. So, but definitely yes, if you have access to aspirin, and if you're somebody that has had prior cardiac problems and you have nitroglycerin on hand, they'll also recommend taking up to 3 nitroglycerins spread out over several minutes to see if that helps with the chest pain too.
Okay. Here's another one from one of our viewers. What role does diabetes play in heart attacks?
Diabetes is a major risk factor for heart disease. It's part of the metabolic syndrome overall, but in long-term exposure of heart arteries and other arteries of the body to high blood sugar and often times the high cholesterol that's associated with diabetes results in basically disease of the vessel. So they become more susceptible to fissuring and causing the heart attack side of things. Also, blood vessels elsewhere like the legs or peripheral vascular disease is provoked as well by diabetes. When a patient has diabetes, we actually look at that as basically equivalent to having had a heart attack already. That's how aggressive we want to be for a diabetic for prevention of heart disease. So we'll be, particularly aggressive with the cholesterol management and the blood pressure management in a diabetic for prevention.
And so just to wrap up today, if you don't mind, let's go back over some of the symptoms and maybe how they differ between men and women, symptoms of a heart attack and the difference for men and women, what people should be aware of.
So again, the majority of patients that are having heart attack will have some kind of chest pain or chest pressure. That's always going to be the number one most common. Short of that, it may feel like severe heartburn would be probably the next most common thing I hear. Radiation of the pain to the jaw, to the back, or to the shoulders can be present that way in a heart attack. When you start going down the line there, the next most common thing would be maybe just sudden onset of shortness of breath, sudden onset of severe weakness can happen. And in general, women do tend to have less of that kind of cinematic, elephant on the chest kind of presentation. They may just have like a slight discomfort. They may not have any discomfort at all and just feel suddenly short of breath or weak. And so as we talked about before, the main thing is don't try to figure it out on your own. If there's any question at all, some new severe symptom that you're having, just call 911 and we'll figure it out. There's really nothing to be embarrassed about if you end up coming in and it's not a heart attack. It's absolutely better safe than sorry. You're not gonna annoy anybody. No one's gonna think that you're wasting our time or anything like that. We will figure it out, and God willing, it's not a heart attack. But if it is, then we can start working on it right away.
Dr. Cook, is there anything else that you would like to add to the conversation today about how to recognize a heart attack or how to respond? Anything that we might not have touched on that you feel is important?
I think we've touched on most of the major things. I think maybe it goes without saying, but maybe not. The best way to survive a heart attack is to not have one, and so that might seem kind of silly, but there are lots of risk factors that can be controlled. Smoking is a big one. Smoking, it takes your heart attack risk and increases it by 2 to 5 times what it would otherwise be. Blood pressure control, cholesterol control are big ones. Exercising some every day. If you can go, maybe 20, 30 minutes of aerobic exercise most days of the week, that also has a preventative effect. So those would be things, to keep in mind in terms of to not have a heart attack. And then the other thing I would say, be concise. If you're having some severe symptoms, come in, and I think what you can say, and it's real simple, I think I'm having a heart attack, and that will get their attention in the waiting room if you've come through the waiting room, and we'll get the EKG on you right away.
Perfect. Thank you so much. And you can find more information about heart attacks and other heart conditions, all the services available through the Blessing Heart and Vascular Center on our website, blessinghealth.org. Now, if you are watching this for credit today, please use the code BeWellHeart911 and give that code to your HR team. Thank you so much for joining us today.
Thanks for having me.